And welcome to NAFDAC and Your Health, that program where you get to know about the relentless efforts of NAFDAC to ensure that only wholesome food products, standard and quality drugs, and other regulated products under the agency's control are made available to the Nigerian public. My name is Amanda Ugo.
On this edition of NAFDAC and Your Health, our focus is on the efforts being made by NAFDAC to combat the menace of falsified and substandard drugs, part of which is the establishment of the Drug-Coordinated Wholesale Centre in Kano. The lawsuit instituted by the National Association of Patent and Proprietary Drug Dealers to Nigeria to stop NAFDAC and PCN from forcing them to relocate to the centre, and the recently held press briefing through which NAFDAC DG and the Registrar of the Pharmaceutical Council of Nigeria jointly addressed pressmen to give updates on the matter. The fight against falsified and substandard pharmaceutical products is one that NAFDAC does not take with levity, as it goes a long way in determining the well-being of the Nigerian citizens. NAFDAC, under the leadership of Professor Mojisola Adeyeye, has however adopted various strategies towards curbing the menace. NAFDAC has been collaborating and forming synergies with the relevant authorities and stakeholders in the efforts to curb falsified and substandard medicines, among other responsibilities. One of such efforts is the idea of drug-coordinated wholesale centres. These are central markets where dealers in pharmaceutical products in the open market can operate from. The first of such coordinated wholesale centers was commissioned in February 2023 under the administration of the former governor of Kano State, Dr. Umar Abdullahi Ganduje. The center is an ultra-modern center that is believed to be a safe haven for quality pharmaceutical products.
NAFDAC is mandated to control and regulate the importation, exportation, manufacture, distribution, sale and use, advertisement of course, sale and use of medicines. What we do every day is to ensure that the drugs that you buy are of quality. We have gadgets that we identify drugs that are counterfeited, that are fake or falsified. We should be very happy today. We should be very happy that the medicines that we're going to be using in Kano are medicines that are supposed to make us better. Kano has become a model for Onitsha, for Lagos, and for Aba.
The Coordinated Wholesale Centre is also expected to be built in other cities like Lagos and Onitsha, where drugs are sold in the open market in large quantities. On the 26th of November 2024, the Director-General of NAFDAC, Professor Mojisola Adeyeye, and the Registrar of the Pharmaceutical Council of Nigeria, Pharmacist Ibrahim Babasheo, jointly addressed a press conference at the Isolo Lagos office complex of NAFDAC to give updates on the relocation of the drug dealers to the Coordinated Wholesale Centre. The NAFDAC DG and the PCN Registrar took turns to give the details.
This disorderly chain of movement of medicines in the supply chain from the manufacturer to the final consumer is inimical to the efficacy of pharmaceutical products and is the primary cause for substandard falsified medicines in circulation. The consequence of this is treatment failure or even deaths. Therefore, to make Nigerians healthier and reduce mortality, NAFDAC and our sister agency PCN must continue to fight against substandard falsified medicines. The fight started decades ago when the Presidential Committee on Pharmaceutical Sector Reform, constituted in 2003, developed strategies towards the sanitization of the drug distribution in Nigeria. The Coordinated Wholesale Centres, where the open marketers can be relocated for proper monitoring is a product of this pharmaceutical sector reform. The Coordinating Minister of Health and Social Welfare, Professor Adeyeye, is one of the architects of the CWC back then and was in full support of the centers. The sector recommended the development of national drug distribution guidelines as a key strategy to coordinate the drug distribution subsector and non-operators in the open drug markets in Kano, in Lagos, Onitsha, and Aba, and were given December 2018 as deadline by the then Minister of Health, Professor Adeyeye, to relocate to CWC. The NDDG, or the distribution guidelines, gives clear mandate to the regulatory agencies, Pharmacy Council of Nigeria and NAFDAC, to ensure its full implementation and compliance by all concerned stakeholders. This is in step with the PCN that regulates the practice sites and the practitioners, and with NAFDAC mandate of regulating and controlling the distribution, sale, and use of drugs to ensure that the quality, safety, and efficacy are maintained. Sequel to this court ruling, the National Agency for Food and Drug Administration and Control, in conjunction with Pharmacy Council of Nigeria, in February 2024, embarked on the enforcement action to cause the relocation of the medicine dealers from the open drug market in Sabongeri, Madam Kato, and my Karami to the Coordinated Wholesale Center. A total of 1,370 wholesale medicine outlets and packing stores were sealed in the 3 open drug markets. The owners of these outlets were forced to move on the 19th of February to the Coordinated Wholesale Center in Dangwauro.
The Registrar of the Pharmaceutical Council of Nigeria explains further the trajectory that led to the building and commissioning of the Coordinated Wholesale Center.
I want to add to the information with respect to the establishment of CWC, that's the Coordinated Wholesale Center in Kano, which of course happened to be the first to be built and commissioned last year, February 10. It shouldn't be seen as an overnight journey. It was a journey that started way back to 2017, when the then Honorable Minister of Health, continuing with the ongoing implementation of National Drug Distribution Guidelines, mandated us to undertake site approval for the various sites that were given. The medicine dealers in Kano, and not just in Kano, in other places, have resisted all attempts by concerned regulatory authority, PCN and NAFDAC, to relocate their facilities to the CWC. Particularly in Kano, they have been based in the open drug market, Sabongeri market, in Mekarami Plaza, Niger Street, Malankato, and Sabongeri areas of Kano, who of course are supposed to move to the Coordinated Wholesale Center in Dangwauro area of the state. The dealers, in an attempt, having realized that the facility has been completed, in an attempt to thwart the relocation, instituted a court case against the PCN, which has responsibility for licensing the CWC. The judgment referred to above by the Director-General of NAFDAC, that open drug marketers should move to Kano CWC, is a monumental one, because it's consistent with the various legislations of the country. The CAPC 34 LFN 2004, the Poison and Pharmacy Act CAP 535 LFN 1990, as well as the Pharmacy Council of Nigeria Establishment Act 2022. Therefore, the judgment that they should move to the open drug market, to the Coordinated Wholesale Center, is one that is well appreciated, and of course will go a long way to curtail the prevalence of substandard medicines in the country. Let me state here that with the coming on board of the Director-General of NAFDAC since 2017, This, of course, has been a key pillar of our administration.
You have been watching NAFDAC and Your Health. The program continues after the break.
NAFDAC wishes to sensitize the general public on the detrimental effect of alcohol consumption by underage. Underage drinking can result in psychosocial and health problems like poor academic performance, increasing crime rate, alcohol dependency, mental health disorder, cardiovascular problems, kidney and liver diseases, and even death. NAFDAC advises parents and guardians to stop the exposure of young people below 18 to alcohol by asking them to sell or purchase it. Manufacturers must desist from packaging alcohol in sachets and small packs less than 200 ml that are sold in attractive and affordable prices for the underaged. Together, we will fight the scourge of underage alcohol abuse. For more enlightenment on NAFDAC activities, watch NAFDAC and Your Health program every Monday, 6:30 p.m. to 7 p.m. on TVC and every Tuesday, 8 p.m. to 8:30 p.m. on NTA. NAFDAC, safeguarding the health of the nation.
Welcome back. You are still watching NAFDAC and Your Health.
The collaboration between NAFDAC and the Pharmaceutical Council of Nigeria is one of many of such collaborations and synergy that NAFDAC has been engaging in over the years to ensure that the agency maximally delivers on her mandate. Part of the numerous groundbreaking achievements is the extent to which the agency has been able to combat the importation and use of drugs like tramadol and other such substances whose impact on the users fuel crime and terrorism. NAFDAC had before now been in partnership with the National Counter-Terrorism Center, Office of the National Security Advisor, and as part of the National Action Plan to advance in this cause and further stem the tide of drug use, the Director-General of NAFDAC, Prof. Mojisola Adeyeye, led the management of the agency to the headquarters of the National Counter-Terrorism Center in Abuja earlier in the year to sign a memorandum of understanding as part of the action plan to ensure the prevention of counterfeit medicines, use of medicines for terrorism, banditry, violent extremism, and to help curtail the illegal drug trade in the country. The agency has recently signed a memorandum of understanding with the Nigeria Customs Service at Abuja. The signing of the historic working document is to enhance exchange of intelligence and information sharing, streamline modes of operation, and provide infrastructural and logistic support. In the same vein, NAFDAC also signed a memorandum of understanding with the National Drug Law Enforcement Agency to improve operations and synergy. The Director-General of NAFDAC, Professor Mojisola Adeyeye, stated that NAFDAC and NDLEA have been working on this MOU for the past 6 years, and today it has become a working document that will improve operations of the two important and critical agencies of government in the regulation and control of drug use and misuse.
It is so important because of you and I. We may not be taking illicit drugs, but we may have relatives taking illicit drugs. We may not have relatives taking illicit drugs, but we may have friends of relatives taking illicit drugs. It is not knowing what your neighbor may do to you, because illicit drugs alter the state of mind. Illicit drugs directly work on the central nervous system and make one feel what one is not supposed to feel. And that can include violence, terrorism, banditry. And those are the higher levels of societal ills that illicit drugs can result in.
Professor Adeyeye stressed the significance of signing the MOU as a call to national security and to control the use of illicit drugs in the country. She emphasized the dangerous effects of illicit drugs in altering the state of mind and also directly working on the central nervous system. The NAFDAC Director-General thanked the NDLEA Chairman, General Buba Mawa, for his unwavering commitment and dedication to make the signing of the MOU between the agencies possible. The NDLEA chairman maintained that NAFDAC and NDLEA play vital roles in our citizens' health and safety.
While the NDLEA focuses on combating illicit drug production, trafficking and abuse, NAFDAC is responsible for regulating and ensuring the safety of foods, drugs and other consumables. Therefore, deepening our collaboration will ensure robust protection for public health and the well-being of our citizens. Our collaboration spans several decades, and we are here to strengthen it further today. Ladies and gentlemen, through this MOU, we hope to establish a framework that will enhance the sharing of vital intelligence, facilities, and expertise. This collaboration will amplify our ability to effectively address the intertwined challenges of drug abuse and counterfeit products.
The signing of the MOU, according to the NDLEA chairman, will strengthen the collaboration between the two agencies that span several decades.
And now, moving on to NAFDAC news updates. The National Agency for Food and Drug Administration and Control, NAFDAC, has shut down an unregistered bakery producing St. Patrick bread at Elenewo, Port Harcourt. The bakery, located at number 14, Old Refinery Road, Elenewo, was producing in an unregistered facility and unhygienic environment with rusty flour mixer and dirty production room. The River State Coordinator, pharmacist Emmanuel Onogu, who led the operation, said the illegal bakery was operating without license and using the labels of popular brands to sell their bread. The state coordinator warned that hard times await illegal producers of NAFDAC-regulated products and enjoined would-be producers to adhere strictly to the agency's regulations and also seek NAFDAC approval before production. That was NAFDAC Update. You have been updated.
This is where we draw the curtains on this edition of the program. We shall be back again, same time, same station next week with another detailed package. If you have any information that could lead to nipping the activities of peddlers of unwholesome food products, drugs, cosmetics, and medical equipment in the bud, please do not hesitate to reach out to NAFDAC.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
Remember that it is illegal to produce, import, distribute, market, advertise, or sell unwholesome food products, fake drugs, cosmetics, and medical equipment. These acts pose great threats to the health of Nigerians. Till we meet again next week, stay safe.